President John Dramani Mahama has called for sweeping reforms within the global health system, urging the World Health Organization and international partners to support a new era of health sovereignty for developing nations. Speaking at the 79th World Health Assembly in Geneva, Switzerland, President Mahama said global health reforms must go beyond symbolism and confront structural inequalities that continue to leave poorer nations vulnerable during health crisis. According to President Mahama, health sovereignty means countries having the practical ability to finance essential healthcare systems, regulate medical standards, manufacture medicines and vaccines locally, and control their own health data. The president expressed concern over Africa's limited pharmaceutical manufacturing capacity, noting that although the continent bears roughly 25% of the global disease burden, it produces less than 1% of the world's vaccines. President clarified that the call for sovereignty should not be mistaken for isolationism, but rather as a push for resilience and self-sufficiency within interconnected global system. He also criticized donor-driven health frameworks that, in his view, burden health officials in developing countries with excessive administrative demands.
In Mali, the Dogon people warned that do not let the sight of those eating roasted maize force you to cook your maize seeds. If we launch a process of reform that is prohibited from recommending actual reform, we are merely performing a ritual. We cannot prioritize institutional comfort over human survival. The WHO's legitimacy is not served by protecting silos. It is served by a fearless analysis of what works. When I hosted Director General Tedros, President Obasanjo and many others in Accra in 2025, we firmed up a vision for health sovereignty. To us, sovereignty is the practical capacity to finance core functions predictably, regulate quality at the regional level, and produce critical inputs locally. A continent that manufactures less than 1% of its vaccines while carrying 25% of global disease burden is not sovereign, it is vulnerable. It is at best a ward of the international system. And by sovereignty, we do not mean isolationism. We are advocating the practical capacity of a nation to finance its own core functions, regulate its own quality, produce its own medicines, and govern its own data. Ministers of health in the global south often spend more time writing donor reports than designing and fixing primary health care. This is a system that has confused the multiplication of institutions with the multiplication of impact.
President John Dramani Mahama called for increased investment in local pharmaceutical manufacturing and the strengthening of health supply chain, urging global partners to support developing countries in building resilient health systems.
And as I prepare to join many of you at our side event later today to discuss health sovereignty in depth, I leave this assembly with three requests, three asks. First, let us not let reform be a ceiling. If we are to fix the system, we must be brave enough to look at institutional mandates and measures without fears. Second, let us invest in execution. The world does not need more communiques. It needs deal rooms, local factories, and resilient supply chains. And third, let us measure success by the clinic, not the conference. The only metric that matters is whether a child in the global south has a reasonable chance of survival as a child in the global north. Colleagues, the old global health order built in the aftermath of a different century is tottering. But a new order is rising. And this will be an order that is defined by agency, not aid, by partnership, not paternalism. And it is being built for the mother in the global south who, even as we speak this morning, will be delivering her child under the light of a lamp tonight.